Get started. Good morning, everyone, and happy Friday. Welcome to the 2025 Empowering Health webinar series. This series will explore the intersection of health and technology, diving into the tools, challenges, and breakthroughs that are shaping how we care for ourselves and our communities. My name is Nerese Millette-Williams, and I am the project coordinator for the University of Maryland Extension Marylanders Online program. This event is brought to you by the University of Maryland Extension in partnership with the College of Information and in collaboration with our Family and Consumer Sciences partners. We have a great session planned for today, and this is our last session of the webinar series, so we're really glad that everyone's here to be a part of it. And before we get started, I wanted to state that all university programs, activities, and facilities are available to all without regard to race, color, sex, gender identity, or expression, sexual orientation, marital status, age, national origin, political affiliation, physical or mental disability, religion, protected veteran status, genetic information, personal appearance, or any other legally protected class. Additionally, please see the following slide that includes QR codes for meeting our speakers, as well as their bios and contact information, which will be found on our website. Completing the conference survey for after this panel, and then you can disregard the registration QR code. Additionally, you can find this on the program agenda that was sent out to you today in our website. So I'm thrilled to kick off our last session of the series today, and we're excited to discuss digital health technologies and misinformation, navigating the challenges in a panel discussion with Jaleen Johnson, Karla Suomala, Griffiths, and Kimberly Harris. Jaleen Johnson is the program manager of the Northwest Regional Telehealth Resource Center, NRTRC. In her position, she provides technical assistance in developing digital health networks and creating disseminating resources. Griffiths is the founding executive director of DigitalLIFT, formerly known as Community Tech Network, a nonprofit strengthening communities through tech training and resources. A founding board member of the National Digital Inclusion Alliance, Cami is a national voice on digital inclusion. Karla Suomala is co-director of the San Francisco Tech Council, a unique multi-sector collaborative focused on bridging the digital divide for older adults and people with disability. She specializes in digital literacy for older adults and tech capacity building for nonprofits. And finally, Kimberly Harris is the co-founder of Health Tequity, LLC, advancing health equity through digital tools. She chairs the board of DigitalLIFT, a nonprofit bridging the digital divide, and is a recognized leader in aging and technology for her work with OATS and its flagship program, Senior Planet. So it's an honor to have you all here with us today. Please welcome our panelists.
And it's an honor to be here. Thank you so much, Nerese, for the introduction. I'm just going to go ahead and share my screen really quick. We have a few slides, but this will mainly be a discussion for us all today about digital health technologies and misinformation. Today, we're going to examine some key issues related to telehealth, electronic health records, and data privacy, while also addressing some common misconceptions and best practices for ensuring community access to accurate health information. After some brief introductions from us all and our and information about our organizations, we're going to discuss some of our main talking points. First, we're going to navigate telehealth and digital health services, what they mean, what they are. And then we're going to jump into information about combating misinformation and promoting safe practices. Finally, today, we're going to wrap up with some best practices and resources, different tools that you can have access to that support understanding about digital health technologies in your communities. And we're going to take some time in between each discussion point for your questions. So please feel free to unmute yourself or put those in the chat when prompted. But to start us off, I just wanted to talk a little bit about the TRCs who are not familiar already. So I work with the Northwest Regional Telehealth Resource Center. We are funded by HRSA and the Office for the Advancement of Telehealth. There are 12 of us across the nation, actually 14 total, 12 regional and 2 national telehealth resource centers committed to implementing telehealth programs for rural and underserved communities. We like to pool our expertise under this consortium, aka the National Consortium of Telehealth Resource Centers, or NCTRC, to ensure that our technical assistance is provided with the best information possible. And we often collaborate to develop new tools and resources for the communities we serve. If you take a look at this map, you can see my region covers pretty much Alaska down through the state of Utah. I know that a lot of you guys are from Maryland. That's under the purview of the Mid-Atlantic Telehealth Resource Center over here. But there is a telehealth resource center for every region throughout the US, plus the national ones focusing on policy and technology up here. You could reach out to us anytime for free information about implementing and sustaining telehealth programs. Sorry. Let me stop sharing. With all that being said, I'm also going to pass over to Karla to introduce herself first.
Good morning, everybody. It's so great to be here with all of you and to my colleagues on this call today. The San Francisco Tech Council is sort of one of a kind organization in the country. We haven't heard of others, where we focus on making sure that older adults and individuals living with disabilities aren't left behind in the digital world. This has become more and more important since the pandemic. I think before the pandemic, we talked about these sort of things as nice to have, being connected, having a device, having the skills to connect to the larger world. That's no longer the case. These are basic human rights. And we can no longer, so there's no turning back, so to speak, to a time when, you can have Wi-Fi if you want it or if you can afford it. We focus on a lot of things at the Tech Council, and I think the project that is most relevant to this call is a pilot that we recently did on patient portals, where we looked at older adults in San Francisco, and we piloted an immersive sort of sandbox training device to help people learn how to use their patient portals. So instead of PDFs or videos, it's actually like your portal, and you can practice on it without breaking anything, without needing passwords, things like that. Along the way, we realized a lot of things that stand in the way, and we'll hopefully, barriers and things that work to get people on. And we'll talk more about that later today, but great to be here.
Thank you, Karla. Kim, would you like to go next?
Sure. Thank you, Jaleen, and hello to everybody. Thank you for spending your Friday morning with us. This is a topic really close to my heart. I'm Kimberly Harris. I've been working on digital inclusion initiatives since the internet was in computer labs and internet cafes, in a lot of different roles, and I'm thrilled to have worked with everyone on this panel in different roles over the years. My beginning working was with older adults in technology for about 15 years, and really understanding how people adopted technology as it was evolving. Well, technology really always outpaces our ability to adapt to it. And what's really started to happen is a new digital divide, where things that are out there and available are not necessarily accessible to a lot of the population. That's due to internet access challenges and due to different types of pricing and control and opportunities for training. And we founded Health Tequity to really start to make equitable health tools accessible to a broader public. And that's not just the end learner, but it's also the communities and systems that support them, that are not always online or comfortable in the digital world. So hopefully I can add some nuance to this conversation and highlight the work of my colleagues on this call who are doing tremendous stuff in the field. And thank you for having me.
Thanks, Kim. I'm going to give it finally over to Cami to introduce herself as well. Thank you, Cami.
Nice to have, I'm really grateful that you included me on this webinar. So I'm the founding executive director of DigitalLIFT, formerly Community Tech Network. I've been doing digital inclusion work for over 20 years, having started as a volunteer in the recreation centers of New York City. And I received no training at all before I started my work there. And what that led me to believe is it's important to train people when working with new computer users. There are a lot of issues and barriers that these folks face that impede their ability to get online. So I was motivated to do more in this space, and that's why 17 years ago I started DigitalLIFT with the help of a few other folks, and we've been running the program since. Originally, it was direct services in the partner location, so housing developments, libraries, senior centers, and we would provide volunteers or paid instructors to work with the older adults, mostly older adults. And then through COVID, we realized that we needed to, like everyone else, go online and then provide some kind of training for folks who still needed access to the internet. So we built out a capacity program. So we're working with other agencies to help them create or expand their own digital inclusion programming. And this includes health centers, that anywhere that folks are hitting the barrier of not being able to do something because of the internet or a device, that's where we would like to provide support. So in order to get someone to use a patient portal, they obviously need internet devices and skills. And so we'll talk more about that in a few minutes. But just to paint the picture of the needs, 21% of adults in this country say they don't subscribe to home broadband. And surely they're using the internet on their phones, but are they using it safely and independently? So this is the digital divide that we hear a lot about, and that's what I'm here to help on. So thank you.
Awesome. Super excited to have you all with me. These are amazing people in their fields, and really, really excited to get into the discussion today. So let's jump in. So we're going to start off by just doing a little bit of level setting so that we're all on the same page, and really talk about what some of the actual definitions of digital health technologies are. Digital health is really more of an umbrella term for many different things. I think of telehealth and telemedicine, those terms in kind of the same way. They can refer to a lot of different things in terms of technology and healthcare. So we know that could be kind of confusing for most people, including me sometimes. So that's why we just wanted to kind of really lay down some definitions for you guys, so that as we're talking further in the discussion, you kind of have that base. When we talk about digital health, telehealth, or telemedicine, what we're often referring to is a mode of delivering healthcare services through the use of telecommunication technologies, including but not limited to asynchronous, synchronous, and remote patient monitoring technologies. And of course, if you're confused by any of that terminology, we'll be defining that as well. But starting with asynchronous technology, this is a mode of health that is sharing of stored patient information through things like patient portals, health records, labs, and images. So Karla was talking about, patient portals and how to utilize those. Those are the apps on your phone where maybe you're making an appointment, you are emailing with your provider directly, you're refilling prescriptions. That refers to kind of some of that asynchronous technology. Synchronous technology kind of refers to the real-time interactive video. So things like virtual appointments, maybe some counseling that is over a chat, or an actual, traditional telehealth appointment where you're seeing and engaging with a provider on a video. That's kind of what we refer to in terms of that real-time synchronous technology. And then finally, we have remote patient monitoring technology that is also a big part of digital health. Health monitoring tools are wearables like heart monitors, continuous glucose monitors, or fitness trackers, where information and participant data is stored and sent to a provider for review. So continuous glucose monitors have been really a big game changer in this arena for that. People who are working to manage their type 1 or type 2 diabetes have, a monitor that continuously measures their blood sugars and helps them and alerts them to when they need to take some action on that. And even things like your Fitbit or a smartwatch can be something that you and a provider can utilize together to manage healthcare conditions or your own healthcare. There are lots of benefits and limitations to all of these. Of course, I always like to just, when we're talking about definitions of level setting, just also note that digital health technologies and things like telehealth are not a replacement for in-person engagement with your provider. There are things that are really, really great and appropriate for digital health technologies. And there are things that you just really, really have to be in person to do. So it's definitely to be utilized as like a tool instead of, a replacement for any healthcare. But that being said, there's a lot of barriers in the way of all of these things, things like broadband access, things like device access, and of course, digital literacy. So with that being said, I would like to turn over to Kim to talk a little bit about the fit of digital literacy in health literacy and how we're introducing these things into our communities.
Thank you, Jaleen. I appreciate that, and it's a hard topic because it's so broad, right? As we think about health in broader ways and more upstream interventions and things like social isolation, the definitions of digital health technologies can expand even further into music playlists to go exercise more, or recipe books to figure out how to make, low salt meals. So I love thinking through this lens of what is the actual hook. What do communities need? What do individuals need to figure out a pathway for it? And there are really two approaches with digital health technologies when it's implemented for health purposes. For example, you can teach somebody a specific skill. And I think one thing I want to level set with everyone is having taught thousands and thousands of older adults. And I know Cami and Karla, Jaleen can attest, and older adults are not the only population that are not online, but in many ways it can be a canary in the coal mine in terms of what's working or not for new learners. But after teaching thousands of older adults about all types of digital skills, I assure you they will learn. It may take longer and different approaches, but people are capable of learning, especially when something's relevant to them. And the good news of working with adult learners is they have frames of reference, they have goals, and they have things that are important to them. And finding those hooks and building them into community is very important when it comes to health. Although we're specifically talking about health literacy and digital literacy, I shy a little away from the word literacy when I can, because it implies a foundational knowledge that is the same for everyone and a kind of certain achievable goal. And as we know with healthcare and as we know with the internet and all things online, that's just not possible. So figuring out ways to help narrow that to digital skill building and to really patient empowerment as a first entry point to digital health is a really healthy way to bring people into the online world safely and feeling empowered through the resources. I think that Karla spoke to a point that I always like to really underscore is that, when the internet started becoming more popular, it was really seen as a personal problem or a personal issue if somebody wasn't online, but it's absolutely become a social issue. It's become so much so that even we know for a fact now, 5 years after COVID, that communities that did not have internet access and people who did not have broadband at home died of COVID at higher rates than anyone in the population. That is across race, economics, gender, and geography. These are real outcomes, and it's not just because they didn't have the internet, but all of the different connections and the way that internet is anchored as a social determinant of health overall for people's health and well-being is something I can't underscore enough. And I'm excited to have Cami and Karla and Jaleen talk about specific entry points and tools for all of you to be able to use to help your communities come online.
Yes, excellent points, Kim. Thank you so much. Cami, can you talk about the digital divided digital health tools a little bit? What are some of the technical barriers that you see in accessing EHRs and patient portals for the general population?
Yeah, it's a challenge because those of us who have technology surrounding us every day, our friends and family, we're all connected all the time. We forget or we don't know that there's still millions of people out there struggling to do what we think is the most basic thing online. And if we don't see the problem, we're not going to act on the problem. So I'm here to say there's a problem of folks not having access to the internet or knowing how to use it in a way that's safe. And so if we think about getting folks onto a patient portal, let's work backwards from there. You need an account on the portal, and you need an email address to create an account on the portal. And sometimes you need a smartphone in order to authenticate that login. So these are all things that have to be set up. And often new users may have an email address that somebody else set up for them, so they don't remember how to log in, or they never knew how to log in, or they're creating an email address for the first time with the help of, say, one of us. And just knowing how to use email is the first barrier. But how do you get email if you don't have a device or internet? And so these public computer centers are critical in helping to train folks on the very basics. But really, folks need access at home so that they can feel that they have the privacy to have conversations with their doctor, or to be able just to have the time to look things up when you have that question. So all of this requires access to the internet, the appropriate device, and then the digital skills. And the digital skills keep changing, because an interface, all of a sudden, the button's on the right side and not the left side. And that can throw people off, or the user interface is not great, that there's low contrast, and it's really hard for people to see. So there's these barriers that I think we overlook, or we just think, oh gosh, they moved the button again. Maybe you curse a little bit, and then you move on with your life. These are real barriers for folks. They might think, oh my gosh, I broke it. What did I do with the button? And then they give up. So we'll talk more about, like, how can we help folks get the, have the community around them to get those questions answered. But these are real problems that those of us working directly in the community with people disconnected, we have an opportunity to make a difference in their lives by helping show them how to use these tools safely and independently.
Thank you, Cami. Finally, Karla, can you talk about how we address some common misconceptions about digital health services, including how effective they are and also their security?
Sure. I think one of the things that when we're looking at services online today, one of the things that we all have in the back of our minds, maybe the front, is scams and fraud. And how can you tell if something is real or not? And who should you give your information to online? This is a challenge for everybody, even those of us who are immersed in this day in, day out. We have to take time to figure out, is this a legit website? Is this a legit kind of thing? This is even more pressing when it comes to health. And over the last number of years, there's really been a proliferation of health information, health services, health advice online. And a lot of it is great. If you're using your patient portal, a lot of it is trusted. They protect your information. A lot of it is not, unfortunately. And there's a lot of stuff out there that is really not necessarily safe. When you're looking at basically telehealth and digital health, one place to start is your patient portal that's recommended by your medical team and your insurance, right? You're paying for it. You know that it's HIPAA compliant. You know the site is secure. They're not sharing your information with other people. You are talking to a real doctor or health professional that you know. These are all kinds of things that help you figure out. There's a lot of other stuff out there online that is not necessarily registered or HIPAA compliant. You don't know what they're going to do with your information. You have no idea what they're going to do with it. They may not be accredited in terms of having the licenses and degrees that they say they have. And they may not be transparent about all these other kinds of things. And so those are always a couple of things to take a look for. I want to point out one area that's even bigger than these other two, the big gray. There are a lot of services out there today, especially in sexual health, dermatology, ADHD, and other mental health kinds of things. People promising you quick prescriptions. Just take a quiz and we'll send you Adderall. These are a whole dubious category that really needs to be taken into consideration. Have to be very careful in using those kinds of services and really figuring out who they are and where they're getting their stuff, and whether you should use them or not.
Absolutely. So I did see Arissa's hand go up. I think that's kind of a check-in point to see at this point, now that we've kind of had some time to give some definitions, to talk about some of the barriers, some of the opportunities here, that we would love to take any questions that we see from the audience really quickly before we move on to the next discussion point.
Please feel free to add any questions you have throughout the panel discussion in the chat, or you can use the reaction function to raise your hand, or you can come off of mute as well. We do have one question here from Kelly. I hope I pronounced that correctly.
Yes, you pronounced it correctly, Kelly Dominique. Thank you so much for this presentation. It's very near and dear to the work that I do. One of the things that I've noticed, as you mentioned, Karla, is around the user experience when navigating mobile apps to access your patient portal. I know, for example, with using Kaiser Permanente's app, they did an update a couple of months ago, and I can't find anything. And I'm someone who considers myself to be digitally savvy, right? And so what I usually do is I use my email to create a workaround to interface into the app to find what I'm looking for. But I know not everybody has that, knowledge to be able to do that. So one of the things that I was thinking about is perhaps when they're thinking about updating these apps, if they tapped into their patient community to say, hey, here's what we've developed during the testing phase. How about you all test it out to see the usability of it, and then incorporate the changes based on patient experience rather than those heavy IT teams that I know are behind the updates.
I want to just jump in there really quickly. I would love for that to happen, to be perfectly honest. Every day, I wish that could happen. A lot of the platforms that are most commonly used out there, the ones that Kaiser uses, the ones that most healthcare providers in the country and systems use, we have found really a deep, deep disinterest on their part in talking to users. And I think that we need to build up more pressure and telling our providers, this portal does not work. It is not helpful. It is confusing. It takes too much time to learn, and it is more confusing than helpful. And I think if we had a real upsurge in patients contacting their providers, and especially insurance companies, because they're the ones who are ultimately paying for this, I think that could be a step forward. But you are absolutely right, and you're about these portals. And I was just looking at my Kaiser Permanente platform myself and thinking the same thing.
And I want to add that it's in the company's best interest to have a better app, because in a few years they're going to be beat out by other companies who are paying attention, who are user testing their apps with the appropriate audience. Like if they expect an older adult to use the tool, then actually have them test it in front of you. And it's happening, it's just not happening at a large enough scale.
Yeah, well, and I just to follow up with that and help kind of transition to the next point. I think, the feedback that health systems and community health centers for things like that get from their actual patients is of the utmost importance. Sometimes these facilities do have the power to make some changes. They're able to customize. They're able to scale it up to help ease some of this. But they only know what they know, and if they aren't getting that feedback, encouraging people to engage with their healthcare provider more about what makes the tool useful or not useful is so important. So with that being said, I would like to just kind of move on to the next talking point and discussion, which is about combating misinformation and promoting those safe practices. I'm going to start by asking this wonderful panel of humans, what strategies have you found most effective in proactively addressing digital health information? And how could digital health platforms balance this without undermining patient-provider trust?
I'll start. And our work isn't focused on health. It's one of the many things our learners get, then have the power to do once you have the basic digital skills. Having a community around you that understands what you're dealing with, and they can help answer your question in an empathetic and kind way, and you're building trust with that person. So having a place, so if someone doesn't have access to the internet at home and they need to do something online, they know they can go into the senior center where they'll find volunteers who have been trained and can help answer their questions. With that kind of trust, later on down the road, if they hit up against something like, I got this weird email, or I gave a gift card to this person, maybe they can talk about what they did, and folks like us who are trained to work with them can help them with that problem. So really layering in, how do you do safe internet interactions, including health, as you begin to build your skills, and building that in, and not just having this deluge of like things you should be afraid of online, and just kind of building on and getting them excited about things. And YouTube is a great hook to get folks excited about using the internet, and it's also an overwhelming amount of information and misinformation. So always teaching about media literacy and critical thinking as you are seeing information come into you. Is this too good to be true? Does this sound a little fishy? And maybe it is. And just to really dig into the things you're getting, and not just think, oh, I should trust this because it says doctor when the person's sending it to me. So critical thinking, media literacy, and having trusted folks in your community where you can ask those questions.
I would say talking to your healthcare providers is really, really critical. When you have a question about something and you're using your patient portal, often asking them, do you have more information about this? Is there a site you recommend? That's a great first place to start. And they will often, and they can send you to internal resources or other trusted sites. But that is really, really significant, significant in terms of starting with the person, the professional that already knows you and is familiar with your health, and asking for it there. You're paying for it already for these kinds of things. You start there. And before acting on other sorts of things that you're finding online, to back up what Cami says, always trying to figure out if you can find other ways to back up the information. If it's a one-off, it's a problem. If it's, so those are things that I would recommend.
That is an excellent point, Karla, and it really brings me to the next kind of question that I have for you all to kind of discuss. With so much health information available online, how do people really discern credible sources from misleading ones? We've talked a lot in preparation for this about things like Dr. Google, things like WebMD, and kind of those self-diagnosing tools. But on the other hand, sometimes those could be a little bit useful to helping patients and communities kind of understand what is happening with their health. So how do we discern those tools, one, and how can we really utilize some of those tools to clarify information about healthcare, but not replace it as medical advice?
I think I can take that one. On a very basic level, teaching new learners really to trust their own instincts, to take references from their world that they understand and apply that in the digital world is a very helpful motivator. So I was thinking, almost 20 years ago, we had a website that said eat rocks daily. And it's kind of what Karla was saying, like it looked like medical advice, but there were just Dr. so-and-so on it. And how do you find the telltale signs of something being legitimate or not? Certainly that's become more and more complicated. And we've had to think of ways that are not really through technology to help address that. So looking through principles of, how people adopt technology, it's usually somebody who they see as their peer or somebody they trust, helping introduce it and helping coach them through it. I think we fall into the pit of kind of flipped learners and having a young person helping an old person with tech. Well, that can work with tech, but not necessarily maybe with health questions or medical advice. And so finding ways to depersonalize it for the skill building section, like Karla has with a portal that people can trial and see how it works and understand what the components are and what to look for in their own before there's any risk to them, is so, so critical for new learners. And to be able to have a collaboration and mutuality of peers and trusted support people that are all talking about the same thing. There's so much misinformation. We've seen that rampant in communities, and I'm afraid it's going to be, the way things are going, a lot of the, formerly trusted sites and voices maybe not trusted at all, and by wide parts of the population. So how can we build in systems where people have, enough support from enough trusted voices that it doesn't just fall on the physician? Because we've also learned that a lot of people aren't adopting their portals because they're not offered if they speak a different language as their first language, or if they're an older adult. So not only are they not using them because they can't, they're not even offered them. And so that's a problem where we as advocates can also step in and help create holistic, supportive communities and systems that can really integrate a diverse variety of voices into their own healthcare empowerment.
Thank you, Kim. I think that those are all excellent points, and that brings me also to my next point, because I think we'd be really doing this crowd a disservice if we didn't mention the role of AI and automation. Can any of you kind of elaborate on what the role of AI is in helping patients better understand and manage their health? And how can we design some of these tools in the future to create some of those environments of trust and understanding, so that patients aren't confused by just the next biggest and best?
You can start with how to use it, but not design it. We haven't done personally any work with designing for AI, but the language that we get from our doctors can be very confusing, and it can be just a wall of words and might be challenging, especially for folks who don't read in English. So using an AI tool to simplify the language and potentially even translate it so that folks can understand it better, and being able to help them find additional information, and it cites its sources, at least the tool that I use, which gives you an opportunity then to click through and see. And always teaching folks that just because it's coming out through this AI tool doesn't mean it's true, and explaining this idea of hallucinations and that they're filling in the gap sometimes. So always, again, back to the media literacy and critical thinking, really think about what it is that it's sharing with you. But I find it super helpful in distilling lots of dense text into something that I can personally consume more easily. And there are some other ways of like asking it for some advice just to kind of open up the possibilities, like in this situation, given this context, how would I deal with this thing? If you know the right prompts to ask, it can give you some more information to think through, and that information might just scare you, right? If it says something that is very alarming, it could be a worse thing. So just knowing what the rails are, or the barriers to this tool that could cause harm in the end if folks don't know what they're up against.
Since we were talking about Kaiser's app, I want to point out the Kaiser Family Foundation has really interesting health and mistrust information, and we're sending this to everybody afterwards. But a very recent survey they did that was wide scale showed that 1 in 6 adults are using like ChatGPT or chatbots for health information. Only about 36% of them trust the information. So you can take with that what you will, but part of it is also backing up. So maybe we're helping people not need to be experts or doctors when they're looking for health information, but maybe just starting with what to ask a doctor, right? So, my family member was just diagnosed with Alzheimer's. What are 3 questions I can ask their doctor when I accompany them on their next visit? And things that keep technology in the realm of somebody's actual experience in the world can be a very helpful starting point to help them, to get them oriented into how to use these kind of new tools very efficiently and safely.
Thank you. I would like to turn over to the audience at this point because there is a wonderful question in the chat. I think and forgive me if I'm pronouncing this incorrectly. Is it Gingy? If you want to unmute and clarify. Okay, is that how you pronounce it?
Yes, that's a great pronunciation. Thank you.
Yes, go ahead and just kind of elaborate on your question here. I think this is really closely related to what we're already discussing and a great point.
Yeah, I asked this question before you asked the other similar question. I think some of the point are already addressed by the speakers. And I was wondering because different culture has different medical practices, and how does the digital tool can help adjust those cultural beliefs to make them believe about the Western health system instead of their maybe some cultural believe the soul will cure their illness without additional medications. So how can you adjust this?
So something I will drive home in relation to that is just that we always like to note that there are people who live in all kinds of different communities, especially in the rural and underserved communities, where the healthcare that you have nearby is the healthcare that you get. One of the great benefits to engaging with digital health tools and telehealth is that does expand your access to different providers that are right for you. If you are, only able to engage with this hometown doctor that, is embedded in the community, knows everybody, but maybe isn't allotted to treat you in the ways that you want to seek, then telehealth does afford an option for that. You can go out and shop around a little bit more and see the options for that, which is a game changer, I think, in kind of building some of that trust between the medical community and its patients. You can really, really find what you're looking for, and you're afforded to find what you're looking for, and with the expansion of access to better and more tools that you might be looking for. And we've also got a question from Terry Mum. Do you want to chime in on this one as well?
Well, I just, we had a recent training, and Lo Smith brought up this point that they're seeing quite a bit, which is, judgment on clients for not being able to use the platforms, or, just this kind of, they don't care about their healthcare. We've given them these tools, they're not using them. I just think that there is a need to really educate the community about, the really basics of digital inclusion and digital equity. Do you guys see that? Do you hear that? Is that?
Yeah, I'm not sure if I think I'm getting your question correctly, but what we see a lot of is providers themselves not knowing precisely how to use these mechanisms. Doctors, nurses, they don't actually know very much about the portals. What they see is on their desktops in their offices. So they're not very helpful in terms of, first of all, telling patients about patient portals and what they are and what they should use them for. And that is the single biggest factor of whether somebody will adopt their patient portal or not, is if their physician or healthcare provider says, this is available, this portal, and you should use it for this. And often providers aren't doing that. They also the other thing that we sometimes see and hear about often is a medical professional in the office grabbing the person's phone and saying, here, I'll show you. And click, 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 which is and they're not good at it. The single worst use of a clinician's time in the universe is doing that. There should be others that are helping to do that. So, first of all, kind of clinicians talking about what the patient portal is or what the digital health resources are, and then referring them to the next step in terms of this is how to use it. Those two things are really not happening very systematically in our healthcare system today.
Yeah, and we've really seen the value in engaging with digital navigators in terms of healthcare and helping to teach others about how to use digital health technologies, because again, like Karla was saying, it is not a great use of the physician's time to figure out how to do that with their patients. But if there are, which there are in most communities, organizations already doing this work like you all are doing that can help with this. We've really been encouraging health systems to partner more with digital navigator programs because it is a perfect fit. And even for like smaller, like critical access hospitals, community health centers, we've really encouraged them as well because they don't have the resources to have someone solely dedicated to teaching people how to use these platforms. There are already programs in place that can do that. And so that's why we've been really, really encouraging that digital navigator model more within healthcare systems of all kinds.
And I'd
Tammy,
like
did
to
you have
add
something to add?
yeah, the language barrier and the time it takes for someone to learn something and feel comfortable doing it. You need somebody who's patient, who has the time and can sit for at least 30 minutes and layer on the information. Don't just quickly dump a bunch of information and think you've done a good job. That is damaging, to Karla's point. People will then feel, oh my gosh, I'm too old to learn. I can't do this. I give up. And once they've given up, it's really hard to get them back into the mindset of putting themselves out there to try to learn. And you're kind of starting from scratch. So having someone who's trained on site or nearby, so you can sign up and spend 30 minutes to an hour with someone who's trained to work with older adults or new computer users, specifically around their health portal or access to these variety of information that's online. These digital navigators are essential. They speak the language, they're culturally competent, generally speaking. Like, I can't speak for everybody's digital navigator programs, but ours are culturally competent, speak the language, and they're out in the community. So it's just a really great way to help ensure people have the training they need and they can use it confidently because they're getting that help over time. And then there's this other community development piece that's really great. You're having folks interact with each other who would normally not get to interact with each other. So there's this other outcome that happens where you're addressing social isolation and other issues that might be present.
So I am seeing some really great questions and conversations in the chat. In the interest of time, I am going to move to just our last discussion point. We will get to answering as many as possible, but in the case that your question does not get answered, please feel free to reach out to us. We're happy to assist over email or set up a quick Zoom call if you want to dive into any of these topics a little bit more. But the last section, and I'll go quickly because we are running out of time. This has gone really, really fast. So again, like, I appreciate everybody for being here and also our wonderful speakers for talking. But now what we want to do is talk a little bit about what resources are available to kind of help, people in the digital navigator, digital literacy space, to help others learn more about healthcare tools. So I'm going to start by talking about some of the tools created by us and the other TRCs. About 3 years ago, we were able to create and navigating the telehealth neighborhood, which is a training that is available for anyone in a digital navigator type role. Much like digital health and telehealth are umbrella terms, we all know that, a lot of different roles operate as digital navigators, but aren't always titled as so. I will say for the healthcare community, things like community health workers or care navigators are often in this space as well. And we wanted to make a training that was free and available to the public. We started by creating a basics of telehealth and also virtual appointments for digital navigators. That's been live for about 3 years. And then about a month ago, we were actually able to release something on patient portals. So this training in particular, both of these trainings are not geared towards any certain platform. They are totally, electronic health record and platform, patient portal platform agnostic, but there are some really great tools that we created with the consortium that kind of talk about what the commonly used patient portals are, what some of their functions are, and then also some spaces where they have public guides that can help you troubleshoot. There's some great workflows in there and also some great information about security, privacy, different things like that if you're interested. Both of these are free, open to the public, go at your own pace and within our own instance of Instructure Canvas. Many people are familiar with the learning platform Instructure Canvas, but in the case that you aren't, we do also have instructions for access as well. The next person to chat on their resources is going to be Tammy. Tammy, go ahead.
Great, thank you. I just put into the chat a link, several links to some free courses on our website, and then one course that does have a fee associated with it, which is the one you're seeing here, Digital Equity and Healthcare, that we have seen a need in different industries for additional training. So we know that there's digital navigators out in the community doing a range of work, and this training is specifically for them to help better understand the healthcare system and the different tools that they are going to be asked to share with others and help navigate. Our courses and training for trainers and training for managers is geared towards agencies that are relatively new to offering digital inclusion, or that they want to take a program they've had that's floundering and scale it or improve it. And that's the kind of niche that we fit in. We really want to see folks gain home broadband, the skills to use their device independently and safely, so that when they're asked to, hey, I'm going to need you to download this PDF and fill it out. If you have to print it, you have to have a printer too, I get that. But that there's these things we're asking people to do that require more than basic digital skills. And so if we're out in the community in health centers or housing or libraries or what have you, we have a role to play in helping folks over that digital divide to get to a place where they can interact freely and independently and have that power that we all take for granted.
Karla or Kim, do you want to go next?
Sure.
I can jump.
I want Karla to talk about her resource.
Well, I'm just popping it. I'm just popping it in the chat. We recently completed a patient portal pilot, and we were helped by many folks. Even on this call, Dr. Amy Schoen, who's on this call, and then Cami Griffiths staff helped to put together sort of a curriculum guidebook. And anybody who's interested, please reach out to me. We can do a demo. What we've created is a dummy, as I mentioned at the beginning, patient portal, which you don't need to download. It's web-based, but it looks like it's an app on your phone, because that's where we're finding that most people are accessing their portals. And you can practice all the things that we've talked about today, from signing on, but you don't need a password. You can type anything. You can practice ordering a medication. You can practice messaging your doctor. You can practice looking at web results. And it's available in 3 languages: Chinese, English, and Spanish. One thing that we found, however, is that many patient portals in the country, platforms like Epic, are available in English and Spanish. We haven't found any that are available in Chinese yet, but this at least helps folks familiarize themselves with the layout of a portal. In our focus group, Chinese speakers, once they figured this out, would go on, copy their lab results, and paste them into Google Translate, and same for their messages from their doctors. And it's not a perfect solution, but it's better than nothing. So take a look at the report. You'll find it short and useful.
Yeah, and I will just say a caveat to that too. What we've seen in terms of like languages is sometimes a patient portal will say it comes in this many languages, but that doesn't mean that the actual portal comes in that language. It means that there's maybe like some translative, features of the portal where you can see that, but the actual portal and the prompts and everything, really only come in mainly English and sometimes Spanish. But Kim, I'm going to go ahead and pass over to you to kind of close out this section.
No, I appreciate that. I think that these are two examples of really the better practices that have been developed in terms of helping people adopt technology that's important in a safe way and a way to really have that opportunity to trial things without risk, to see what works for them, to have the supportive environment and where something works. I guess that's the last thing I would want to add is when we're seeing all of this technology or what was brought up with the Kaiser portal right now, people that are new learners especially get frustrated so quickly. So helping figure out products and systems that will work, that don't have all the pitfalls or hiccups or bumps that those of us who have been online a long time have learned to navigate is really critical. So even under Health Tequity, we have a patient care coordination and remote monitoring system. And why I'm such a fan, because there are plenty of those out there, but they're not necessarily accessible, not to the end user if they're not familiar with digital technologies, and not even to the systems that have never supported digital health. So we do tend to underestimate end users' ability to learn technology and overestimate systems implementation of technology. And I think that that would be the last thing I would add to this great group that comes to these types of webinars is we can also help be the advocates and the voices of the people that we work with for their unique entry points into these topics. And you are the best ally in that and to push for healthy changes in technology, how it's developed, disseminated. So I hope that summarizes.
Yes. Thank you, Kim, so much. So we are out of time. I do know that Nerys has a few just closing things to mention. And again, if your questions, I saw so many great questions in here. If your questions are still not answered and you would like to reach out to us directly, I'm definitely willing to put some of our contact information in there. What we do as telehealth resource centers is providing technical assistance, so you can reach out to us anytime, anywhere. So please feel free to engage with us, and we're happy to answer some of those questions after the fact, and even set up a quick Zoom call if you want to dive deeper into anything. With that being said, I'm going to pass over to Nerys to kind of close us out. Thank you all for attending, and thank you to our wonderful speakers. You guys are amazing.
Thank you all so much for that really engaging panel discussion. Okay, some people have to jump off. So again, if you have questions, and I noticed some of our panels did answer the questions in the chat. So please, if you had questions, look at their responses. Panel, we do have one question here in the chat from Kelly, which I see Cami just answered. So thank you so much for that. Let me share my screen really quickly. We have some great feedback in the chat. So thank you everyone for being so engaged. I'm just going to share a few quick notes here before we officially close out. So thank you again for such a thoughtful and engaging panel discussion. We really appreciate you all being here. And before we wrap up, I do want to say thank you to everyone who participated. Your energy, engagement, and commitment to advancing health access and technology is truly appreciated. If you would like to get in touch with our program, Marylanders Online, you can reach us by going on our website, which is www.marylandersonline.umd.edu. You can also email us or give us a call at our toll-free tech helpline. We're open Monday through Friday, 10 a.m. to 8 p.m. and Saturday, 10 a.m. to 5 p.m. That is our website. And then you can also connect with us on our social media. We have our Facebook, Instagram, and a LinkedIn. And you can also sign up for our newsletter where you can find out about more webinar series that we have coming up or conferences. And then on that note, I want to say thank you all again, and we hope you leave today feeling more informed and inspired. Please look out for a follow-up email where you can find where you'll be able to find the recording for this panel session on our YouTube page. Also, on that follow-up email, you'll be able to fill out the post survey for today's session, or you can scan the QR code here. So take care, everyone. Thank you again for being a part of the 2025 Empowering Health webinar series.
Thanks, you guys.
Thank you.
Nerese,
Yes.
really quickly, are you available to meet briefly offline?
Yeah, sure.
What should I do?
Actually, if you could just hold on, let me do this real quick. I'm going to